Is it fine in terms of?
Yes, I think it's perfect. Perfect. Yeah. So we just wait for a minute and then we can start.
You will be posing questions in between or at the end?
So you go ahead, Dr. Wadhwa, finish your thing. And then what I'll do is I'll look at the comments and see if there are questions, and then I will pose them accordingly.
Okay. Thank you.
People take a bit of time, to join.
Okay. How many are likely to be medicos or with the background?
I would say a very small percentage.
Okay.
It's mainly from a layperson's perspective.
Okay. But they will be aware of the structure of the body so that we can relate it to the exercise.
Yeah, absolutely.
Some of the common disease conditions and all.
Absolutely.
Thank you.
So
plants are looking nice in your background.
Everything grows beautifully here.
True. I've never been to Ooty.
Oh, it's quite it's a pretty place.
I've heard it. Yeah.
It is. It's been destroyed quite a bit now with the,
But once the COVID is over, I think things will bounce back to normal.
Yes, hopefully. Yes. So I think we can start now, and more people will join. So welcome everyone. Good evening. And I'm Dr. Sheela Nambiar. I'm a gynecologist and a lifestyle medicine physician. And the objective of having these talks with various eminent people is just to educate you on the various aspects of lifestyle which you can take into your own hands and use to implement in order to improve the quality of your life and your health. And today I have one such person, Dr. Sanjay Wadhwa, and I will give you a very brief introduction to Dr. Wadhwa. Dr. Sanjay Wadhwa is currently serving as a professor and head of the Department of Physical Medicine and Rehabilitation at the All India Institute of Medical Sciences in New Delhi, where he's been since 1986. He's also the founder professor and head of the Physical Medicine and Rehab. He is the vice president of the National Academy of Medical Sciences and the immediate past president of the Indian Association of Physical Medicine and Rehab. He's 60 years young and he lives in Gurgaon. His hobbies are reading, drawing, painting, watching his favorite movies, and traveling. And he'll probably tell us what his favorite movies are. Traveling, of course, which has been curtailed due to COVID. His areas of interest include spreading awareness about the role of exercise and physical activity, especially during COVID-19 and in the various lifestyle-related disorders. Dr. Wadhwa, I really appreciate you spending time explaining to us, and you've already told me that you're going to give us a presentation about the importance of exercise, and no one better than you who's been in the field in academia, so that you can actually educate us on exercise, the various aspects of it, the physiology possible. I'm sure most people listening will be very keen to know that. So thank you so much. Thank you for coming.
Thank you so much for asking me to join this program. And I had done some background check, and you have been very active and spreading the message related to health issues.
Lifestyle.
In that context, I'm very glad to be a part of this program today. Thank you so much for providing me this platform.
Thank you.
And I would like to inform your viewers about certain aspects of the exercises and physical activities, which I feel are essential for everybody to know, because exercise and physical activity has tremendous health benefits. Some of these health benefits are known to the people. Everybody knows that if you are regularly active, exercising regularly, maybe you can maintain a better body shape, you can control your body weight better. If you are diabetic, maybe diabetic control will be better. If you have high blood cholesterol levels, it will help in reducing that also, and blood pressure control, etc. But other than these known and appreciated effects of exercises, there are many effects of exercises which are not well appreciated. And it is a common knowledge that if people don't appreciate the benefits of exercises, they will not integrate exercise into their day-to-day life. It has to be realized how beneficial exercises are. One of the reasons for low acceptance and awareness about exercises in our daily life is that most of the people are struggling to meet both ends of the life need. They are busy spending time and hours together in earning a livelihood. Many of the aspects of our day-to-day life have been disrupted by the COVID-19 pandemic, which is very unprecedented and of unimaginable scales. And as a result of that, even some of those who were earlier physically active and engaging in regular exercises, going to the gym or visiting the parks and outdoors for regular physical activity and fitness, those activities were also disrupted as a result of nationwide lockdown, as a result of various other restrictions. Transport was stopped, there was lockdown, gyms were closed. People were very scared because they never knew how to handle this kind of situation. Even the medical science also was taken by surprise. As understanding improved, people are becoming more and more active, and it is being realized that the benefit of exercises are such that even persons with COVID-19 can also benefit by regular practice of exercises and physical activities, of course, with some modifications and limitations compared to a person who has never had COVID-19 infection. So during my presentation, I will be touching upon some of these things, and I will welcome any questions from the viewers. So I will begin my presentation now by sharing the slides. So as I have already told, the topic of my presentation is unappreciated benefits of exercises. Now, many people tend to use the terms physical activity and exercise interchangeably, but the scientific community likes to differentiate between the two. And one of the most often cited source of information to explain the difference between the two is American College of Sports Medicine and the American Heart Association. And according to them, physical activity is any movement that is carried out by the muscles that require energy. In other words, it is any movement a person does. Exercise, by definition, is planned, structured, repetitive, and intentional movement. So this is the key difference between the two. Exercise is intended to improve or maintain physical fitness. And the key thing to focus on when trying to determine if something is just physical activity or an exercise is to ask ourselves a few questions. Am I doing this because I'm trying to improve my physical fitness or health condition? Do I plan to do this consistently from week to week or even day to day? If the answer to both or any one of these questions is no, then the activity probably cannot be considered exercise and is truly physical activity only. If you answered yes to both, then it is most likely considered an exercise. Now, there is another term also which is very important to understand in relation to physical activity and exercise, and that is physical fitness. We all do exercises basically to get into a certain level of fitness or to regain the level of fitness which we may have lost as a result of an injury or disease condition. Physical fitness is defined as one's ability to execute daily activities with optimal performance, endurance, and strength with the management of disease, fatigue, and stress, and reduced sedentary behavior. Now, it has been observed that more and more people have become sedentary as a result of limited opportunities, as a result of more pressure to earn a living, as a result of restrictions imposed by the COVID-19 pandemic, as a result of financial constraints, and very important reason is lack of motivation. And our understanding of the relationship between physical activity, exercise, and health is also constantly evolving. Now, exercises are beneficial for health promotion in general. If you are active and exercising regularly, your health level in general improves. It has also been documented since past few centuries, if I may say, that it has an important role in prevention of certain disease conditions. It has been seen that people who are not active, they are more prone to the lifestyle related disorders. They gain more weight, they become obese. They also tend to have more heart attacks, more strokes, which is a brain attack. They are also more prone to develop certain other disorders such as development of gallstones, certain cancers. So it is very important to understand that exercises help in preventing some of these conditions. And it also helps in early diagnosis of certain conditions. I'll give a leading example of the role of exercise in early diagnosis. There are some people who often complain to us that they easily get tired if they are walking for some distance. Their limited stamina and easy fatigability is sometimes because of a disease of their coronary arteries. So if at rest they are walking about, they have a certain level of symptoms. But when they are made to run or walk on a treadmill, which is motorized, that is a form of exercise. So if they have a borderline narrowing of the coronary arteries, or if the heart muscle is not performing optimally, then as a result of the challenge imposed by the exercise of walking on the treadmill or running on the treadmill in a very controlled way, then their coronary artery disease manifests earlier. So we can diagnose those conditions. Otherwise, it could have been a source of sudden heart attack and precious life may have been lost. Then it is an important part of treatment of several diseases. Many of the musculoskeletal disease conditions, besides prescription of medicines, they have an important component of advice about certain exercises, which in many of the physical medicine and rehabilitation departments are taught to the patients. Common conditions are pain in the knee joint, pain in the shoulder, along with stiffness. Low back pain is a very silent epidemic, and a large number of people with these health conditions benefit if they are taught proper exercises. People who have developed weakness as a result of stroke or as a result of injury to the brain, injury to the spinal cord, they also can be helped by regaining the movement and strength if they are prescribed exercises properly and if they follow it regularly. Then rehabilitation is revolving around the proper prescription of exercises and guidance about physical activities. So exercise has so many benefits, and some of these are well appreciated by now, but some are not so well appreciated. And then there are important recommendations, because you cannot just ask anybody to do anything. Your advice and recommendation has to be backed by science. It has to be evidence-based. And as a result of evidence-based studies, there are certain recommendations by national or international organizations. And these recommendations take into account the health condition of the individual, or if the person is perfectly fit and fine, then according to certain age groups. And some of the important recommendations regarding exercises are by leading world bodies, some of which are American College of Sports Medicine, which was founded in 1954, American Heart Association, and along with American Stroke Association. Their recommendations are very important because exercise is a key component of reducing the risk of stroke and heart attack, as well as helping in recovery of the persons who have suffered a heart attack or stroke. Then Centers for Disease Control and Prevention also has its own set of recommendations and guidelines regarding physical activity and exercises. And World Health Organization is the leading body. And in the year 2020, it came out with the second edition of the recommendations regarding physical activity and exercises. And this is a highly respected source of information. And many nations have tried to develop their guidelines centered around the World Health Organization's recommendations and guidelines. And Fit India is an important addition in India. And it is a very ambitious plan launched by the government of India. It was launched by the Honorable Prime Minister of India on 29th of August 2019. There are several benefits of exercises, and this is a list of 50 ways in which exercises and sports change your body in a positive way. I will not strain the viewers to text their eyes, but you can see the list is very large. In this, I have listed only the 50 ways, but I came across another list in which somebody has listed 93 benefits of exercises. So there are many benefits which are being understood and documented, but sadly, a common person does not appreciate the benefits. The common person only knows a little bit about some of the benefits of the exercises, and that too, he is not putting it into practice to get the benefit out of those things which are known to him or her. And reasons I have already told you. Now, regular exercise stimulates growth of brain cells. It lowers the resting heart rate. It improves your mood. It improves your sleep. It reduces the level of stress and anxiety. It decreases body fat. And it is commonly seen that people who exercise regularly, they are in general more confident. Their posture is different. The glow on their face or the skin is different compared to somebody who is like a couch potato sitting or lying down throughout the day. Exercises obviously are done primarily for improving the strength of the muscles. Also, it improves the body image, boosts your level of energy. You have increased stamina. You can carry out most of the activities without easily getting tired. It reduces the risk of falls. And this is a very important benefit, which is unappreciated. And this is very important in senior citizens or elderly people. In children, regular exercise improves your learning. It improves your memory. Grades in the competitive exams improve if the child has been exercising regularly. Unfortunately, the sports ground size have shrunk. Children are more in front of the computers as a result of the need of online learning, mobile gadgets, video games, etc. But those families which realize the importance of sports and regular exercise for the children, and they encourage the children to engage in regular activities, their children definitely perform much better, and there is a strong body of evidence to support this statement which I have just now made. Exercise helps you become more creative. You have better ideas and you can execute the ideas better. These are some of the things which many people don't appreciate so easily. And then in the COVID-related scenario, it has been observed that exercise improves your capacity of the respiratory system. You are able to breathe better. The oxygenation in every area of the lungs is much better. And as a result of that, it spreads through the tissues of the body much more effectively. And then another buzzword during the COVID-19 has been immunity. Exercise is a well-known way of boosting your immunity. If you follow the recommended guidelines, regular aerobic exercise in moderation boosts the immunity. And as a result of that, people who exercise regularly in moderation, they are seen to fall less ill. And if they fall ill, they recover quickly. Their need for medication is much less than those who have never engaged in regular exercises. The immunity as a result of moderate exercises on a regular basis is primarily against viral infections. And COVID-19 is as a result of infection with the virus, coronavirus. So people must appreciate the beneficial effects of regular exercises in moderation to prevent themselves from coronavirus infection, from common cough and cold, from flu and other such viral illnesses. And if by any chance anybody contracts the viral infection, as a result of the reserves built in the body due to years of regular physical fitness and exercise, their recovery chances are much higher. They will bounce back more quickly and their complication rate will be lower. It has been seen that if we analyze the data of people who get admitted in the hospitals as a result of COVID-19, or even some get admitted into the ICUs. Some people who recover successfully from these admissions, it is found that generally they are the people who have been more active, more disciplined in the earlier years, and they have less comorbidities. Because if somebody is active and exercising regularly, he is less likely to be diabetic, he is less likely to be hypertensive, his cholesterol levels are likely to be more near normal, his blood pressure is likely to be more near normal. So these are important benefits, and this helps in so many other ways. Regular exercise also improves the balance. It controls your body weight, and it also improves the sexual functions of the person. Now, why should I exercise? The answer is very simple, that if I exercise, my stamina is increased, I sleep better, it makes me feel fit and healthy, it sharpens my thinking, my body gets leaner and fitter, it gives me more energy so that I can do many things within the time available in a day. My muscles and bones get stronger. It helps me to relax also better so that when I wake up, I am fit and fresh. It relieves stress in my life. I am less irritable and I don't engage in quarrels and fights with others as often as I used to earlier when I was not regularly engaging in exercises. And my heart becomes more efficient. People who exercise regularly, they are less likely to have heart attacks or sudden cardiac deaths. They are less likely to have strokes. Now, these are some of the underrated benefits of exercises, such as stress and anxiety relief, improved functional mobility, increased energy levels, higher self-esteem. We don't value it as often. Because we value more those things which we can measure easily. For example, our body weight, our waist circumference, our mid-arm circumference, etc. These we can measure easily. But self-esteem is very important. Our sleep quality is much better if we are exercising regularly, and overall health also improves. And sleep deprivation is becoming a very important cause of many other diseases in the modern day life. Now, we tend to enumerate many of the health benefits of exercises, but sometimes we don't appreciate the mechanism behind those health benefits. So in this diagram, I am trying to show that there are some biochemical changes in our body as a result of regular exercises. And these are the changes which are responsible for the manifest benefits of regular exercises. For example, there is brain-derived neurotropic factor as a result of exercises. There are hepatokines which help in better metabolism and conversion of glycogen into glucose. There are adipokines. These are biochemical compounds which are released from the fat cells. Myokines are biochemicals which are released by the muscle cells, because physical exercise is directly related to the muscular contraction and activities. And bone-derived hormones are there, and they improve our bone health and reduce the risk of osteoporosis. And according to World Health Organization, osteoporosis is also assuming a very alarming proportion, and it is a silent epidemic. Many people come to know of osteoporosis only when their bones break as a result of trivial fall or minor injuries. And now there are ways to pick it up early as a result of DEXA scan and other investigational modalities. Now, exercise increases neuroprotection. That means less risk of degenerative diseases of the brain, and Alzheimer's is one of them. Memory loss is reduced or delayed. Stroke is prevented. Increased functional neuroplasticity. By neuroplasticity, we mean ability of the nerve cells of the brain to mold themselves, to shape themselves, to sprout themselves and develop newer connections if there is a problem as a result of an injury or disease. Then there are structural neuroplasticities. That means as a result of regular exercises, the brain cells are bigger, they are more active functionally, they have more branches, more connections. And cognition is very important function. That is why it is said that there are certain mental exercises also in which a person should regularly engage. It has been documented often that people who play regularly chess or try to solve puzzles such as Sudoku, there is less chance of developing Alzheimer's disease or memory loss. Depression is less in people who are physically active and fit, and they are less anxious. Now, strength training is very important. It cannot be underestimated. And there are ways, there are apparatus very often used. It can be a dumbbell, it can be an exercise apparatus in the gym. And there are different types and shapes and sizes of various training apparatuses. And in the absence of apparatus or expenditure of money also, there are certain freestanding exercises which can be performed to improve the strength of the muscles. And we are lucky that in India, we have a great tradition of yoga. Yoga generally does not involve use of any gadgets or modalities or apparatus, but it is a very important source of strengthening the muscles, stretching the joints, improving our balance and stability, and mental relaxation, breathing improvement, etc. It is a gift to the world from India, but now we are realizing its importance after having missed out. But I am glad that on the 21st of June, International Yoga Day is celebrated, and that is a day which focuses increased attention. But this should not be just one day celebration. We should integrate yoga and regular physical activity and exercise into our day-to-day life. Then throughout the year, we can continue to reap the benefits of these wonderful things. Now, there are some studies which have documented that by regular physical activity and exercises, the chances of dementia are reduced by up to 30%. The chances of hip fractures, which happen in elderly, postmenopausal women, they are reduced by up to 68%. Depression is reduced by up to 30%. The risk of breast cancer in women is reduced by up to 20%. Colon cancer by up to 30%. And the type 2 diabetes by up to 40%. And cardiovascular diseases, which are the reason for the heart attacks, they are also reduced by up to 35%. And all cause mortality by up to 30%. Now, these are tremendous gains of regular physical activity and exercises, and these are matched by none of the drugs that are known at present. And drugs are expensive, they have their own side effects, and they have their own limitations, and they have their own interactions. If you tend to take one drug for a particular symptom, and tomorrow, if you have another symptom as a result of another disease, the two drugs may interact with each other and may worsen your condition. Now, fitness training has several components, and traditionally, these are the 5 components of comprehensive fitness: cardiorespiratory fitness, muscular strength, muscular endurance, change in the body composition, and flexibility. And there are certain recommendations for weight loss. Many people are concerned about their body weight. They want to have the ideal body weight and they want it fast. Let me clarify that there is no shortcut. Just like you don't put on weight in a day, you cannot lose weight in a single day. And there is simple science behind weight gain or weight loss. How much calories you are putting into your body and how many calories you are burning. This is first dictum. And it is a balance of the two that decides your body weight. Second is, what is the source of those calories? If these are refined carbohydrates, for example, if you need 2,500 calories in a day, you can get all these calories from a cup full of sugar. But that is not what we are recommending, because you need calories, and other than calories, you also have to have carbohydrates, proteins, vitamins, minerals, and other components of a healthy, balanced diet. For weight loss, the recommendation is that you should pay attention to both the components which are responsible for maintaining weight. That is, you pay attention to the food that you eat, and you also pay attention to the level of physical activity and exercises. It has been seen by us in our common day-to-day practice that people who are overweight, they are often advised that you should start walking half an hour every day or start jogging 15 to 20 minutes every day. Now, those who are overweight already, they land up with aches and pains around the ankle and the knee joints or in the hip, or they have worsening of their back pain. So our recommendation is generally you pay attention to your diet first. And once you have reduced your calorie intake by about 500 calories on a daily basis, over the next 3-4 weeks, you will feel that you are starting to lose weight. You are a little lighter. And once you are a little lighter, then the strain as a result of regular and increased physical activity on the lower limb joints will be much less. And besides paying attention to the exercise and the diet, we also recommend people to wear properly selected footwear and comfortable clothes, and pay also attention to the weather conditions and the surface on which you are walking or jogging. So it is a very important thing to remember that every individual is different and unique, and our prescription has to match that particular individual. No one size fits all, and that is why the exercise prescription also has to be individualized, of course, keeping in view the basic core principles of an exercise prescription. Now, what are the reasons why we want to do exercises? To become fit. And surprisingly, the prescription of an exercise program also is easy to remember if we remember FIT, F-I-T-T. Here, F stands for frequency. That means how many times in a day that exercise has to be done. I for intensity. That means at what level of intensity that exercise has to be performed. And intensity we measure by how much is the increase in the heart rate as a result of that physical activity or exercise. And there are various other methods also of assessing the intensity of the exercise in terms of how much is the oxygen consumption per minute, etc. But the common principle is how much is the increase in the heart rate as a result of that activity. Higher the intensity of that activity or exercise, greater is the rise in the pulse rate. Then comes T, that is a time for how many minutes you are engaged in that exercise. This is very important. And finally, T is the type of activity or exercise. And here it is very important to understand the role of aerobic exercises. Aerobic exercises are those exercises which are rhythmic in nature. They involve large muscles of the body, and they help in improving the cardiovascular fitness and overall health.
Your slides are not moving, Dr.
Yeah, no, I was just speaking at that time. I was speaking that slide.
I got stuck. Sorry.
Yeah, no, that was the now in the earlier this thing, I wanted to say it is a common observation that people start exercising with a lot of enthusiasm. Most of the people have New Year resolution that, okay, I will start exercising, I will take membership of a gym, and I will be very regular. And as the days progress, it has been seen, so many studies have been done that the membership of gyms are maximum during the first 15 to 20 days of the January month of the year. And after that, there is a significant decline. And people get bored, and there are many reasons for not being motivated enough to continue it. But those who are able to keep their level of motivation high, and they continue to reap the benefits. So there are many ways and techniques which mental health experts advise and train the people how to stay motivated. And one of them is that if you are exercising in moderation, and if there is a variety of the movements or exercises that you are enjoying, then you can remain motivated for much higher or much longer duration, instead of monotony of the same exercise every day, day after day. So it is important to have variety of exercises, and that is why there is a mix and match and circuit training programs and so many other ways of exercising are advised to the people. And some people, in order to stay motivated, they combine exercises with the music of their choice, etc. Now, an important question which people ask us, should one exercise during COVID-19 times? If you are in the COVID-19 times, we all are. But if we are not having symptoms, if we have not contracted the COVID-19 infection, then yes, you should continue to exercise in moderation, keeping in view the safety related precautions, such as maintaining social distance, wearing the mask, maintaining hand and face hygiene, and taking adequate rest, maintaining hydration. These are very important things. If you are careful about these things, then you can continue. If unfortunately somebody develops coronavirus infection, then during the acute stage of the infection, you have to have bed rest, no exercises, because it has been seen that COVID infection is not limited to lungs only, although lung is the early and common site of infection involvement. But multiple systems also get affected, sometimes the nervous system, sometimes the heart. So there are people who have been seen to have adverse outcomes if they resume exercises too early after a bout of COVID infection. And there was a lot of concern and worry about one of the celebrities who died soon after recovering from the COVID-19 because he resumed going to the gym too soon and he tried to hit the initial level of intensity of exercises too soon. So there are instructions that some of the people who have turned out COVID-19 negative, they should wait for at least 6 to 10 weeks before they resume their physical exercises. But a low level of physical fitness and activity can be started early enough. One has to pay attention that one of the important difference between routine situations and COVID-19 situation is that as a result of COVID-19 infection, the oxygen saturation levels fall in many people. So regular monitoring of pulse rate as well as oxygen saturation levels by using the pulse oximeter is important. If you are engaging in a particular activity and your oxygen saturation levels drop fast, that means you are not yet fit enough to engage in that particular activity. It is better to take rest over a longer time period. And there are guidelines and protocols how to resume physical activity and exercise if you are recovering from a COVID-19 episode. Now, all the activities can be classified depending upon the intensity of those activities into light, moderate, and vigorous. There are different scales, and some of the scales are based upon how much is the energy consumption while engaging in that particular activity. In general, moderate intensity activities are those in which heart rate and breathing are raised, but it is possible to speak comfortably. So if you can walk and talk, that means you are not in a vigorous intensity level. But if you are walking and unable to hold on the conversation, that means you are engaged in a vigorous intensity exercise or activity and your breathing is heavier. So it is recommended that people for health benefits out of an exercise program or session, they should engage in regular moderate intensity activities or exercises. And these should be aerobic exercises, not anaerobic. Now, the link between physical health and exercise is not something which is non-new. People since centuries have known that people who used to go to the fields, they used to cut trees, get the wood for burning fire to prepare food, etc. They were generally fitter. People who used to go to the jungles for hunting, they were fitter because they were running, they were physically active. An important scientific study was done in 1949 and then it was reported in 1953. It was done by Jerry Morris. And this is an important study. I will just share very quickly because this was a study done on bus conductors versus bus drivers in London. And it was found that because bus drivers are sitting on their seat throughout the period of the journey of that bus, they were more often seen to be suffering from heart attacks. This is a diagrammatic representation of that famous study, which is the London Transport Workers Study, in which 31,000 workers were tested. Now, this is what I was referring to, 93 proven benefits of regular exercise. I will not go into these, but suffice to say that there is no system in the body which does not benefit from the regular exercises. Some systems benefit more, and these are appreciated by the common people. Some systems benefit less, or some systems benefit early and some systems benefit later on. Now, some of the benefits are felt and known, and somebody may ask for a proof, and sometimes the proof may be very difficult to give. But absence of proof does not mean proof of absence. Some benefits arise with very small increase in the level of physical activity for people who are currently inactive. Even if a person is far from meeting the recommended weekly activity levels, those first small steps are very important. Every large journey begins with the first step. So people often take refuge in this thing that I have been lying in the bed because of viral fever or as a result of a fracture. How can I resume activities? The sooner they resume the physical activity, the better will be the recovery and higher will be the recovery. Of course, after due clearance from the treating physicians or surgeons. There is a very important British Association of Sports and Exercise sign, which came with the ABC of physical activity. A, those recommendations which are applicable to all healthy adults. B, recommendations for beginners. And C, those recommendations which are for conditioned individuals. So it is important to follow the system which meets your particular categorization. Aerobic activities should be undertaken in bouts of at least 10 minutes and ideally should be performed on 5 or more days in a week. The more regular one is with the regular exercise, the more benefits and longer the benefits stay. There are many exercises and types of exercises, and common things are weight training, circuit classes, yoga, and other muscle strengthening exercises. And this is what I referred to a short while ago, the FIT principle. How many times in a day, intensity of the exercise, time and type. According to the WHO, one should engage in at least 30 minutes of moderate intensity aerobic exercises at least 5 days in a week, and if possible, all 7 days in a week. So that means 150 to 210 minutes a week regular physical activity and exercise in moderation is recommended by the WHO. If you want to have higher goals and you want to modify the risk factors, because there are certain risk factors for heart attacks and stroke which are modifiable, and these include your body weight, your blood sugar levels, blood pressure, cholesterol, etc. There are some risk factors for these illnesses which are non-modifiable, such as your age or gender or your family history. But with exercise prescription, you can modify those which are modifiable and thereby reduce the risk. Circuit training, I have already mentioned. This is performing activities one after the other as per a structured program. I will rush through some of these things, but I will like to emphasize certain things, that a lack of physical activity causes approximately 6% of burden of disease from coronary artery disease, 7% of type 2 diabetes, 10% of breast cancer, 10% of colon cancer worldwide, and overall physical inactivity causes 9% of premature mortality worldwide. Now, these are the latest guidelines, the second edition of WHO, which were released in the year 2020. And in this, earlier guidelines used to focus on physical activity. And this is the first time they have highlighted the importance of cutting down the sedentary behavior. So that is why it is a part of the title of their guidelines. People who are not active for 90 minutes or longer at a stretch in a day, they are also at a much higher risk. And this risk is not completely nullified if they engage in 30 minutes of exercises regularly. So both are important. Regular physical activity, that is a positive dimension, and cutting down the sedentary behavior, that is reducing the negative behavior. So fitness depends a lot on the behavioral change. And this is what I was referring to, the Fit India campaign. And this is a very important initiative of the government of India. And they have developed certain protocols according to different age groups. And this is a protocol and guidelines for 5 to 18 years age group. This is for 18 plus to 65 years age group. And this is for 65 plus years age group, because the needs for all different age groups are different. And exercises have to match that particular age group. And this I have already shared with you. There are also separate set of guidelines for children under 5 years of age, because no section of society should be left behind. Exercise is beneficial for all age groups, both genders, at all times and ages. And WHO guidelines, as I have already told you, it includes reducing the sedentary behavior. And this is an important change compared to the earlier 2010 guidelines. And these are various mechanisms to explain the benefits. I will not go into that because most of the viewers are likely to be non-medical. Myokines are basically chemicals released by the muscles. And muscles are the primary organ of the body, which are involved in exercises and physical activities. And we all know that how our diabetes control improves, our heart becomes more conditioned and fitter, we get less tired, we can do much more. Our blood flow into different tissues and organs improves. Now, coming to the close of my presentation, I would like to say that exercise is perhaps the best medicine known to us. It is universally available. It can be performed across all age groups. It is the least expensive lifestyle intervention. It is free of side effects, provided you are doing within the safe limits, but it is least practiced. That is the sad part of it. And the greatest thing about this is that it is never too late to start. You can make a beginning now. And there are also many experts who say that if exercise were packaged in the form of a capsule or a tablet, it will be the most profitable kind of medicine. Pharma industry has unfortunately never bothered about these things. They never emphasize the role of exercise. Exercise can lower your cholesterol much more than the statins. Exercise can lower your blood pressure much more than antihypertensives. Exercises can lower your blood sugar levels much more than anti-diabetic drugs or insulin. And exercise affects so many systems of the body that this is one intervention which can improve your immune status. It can reduce inflammation in your body. It can reduce the risk of cancer. It can reduce the risk of heart attack, stroke, etc. And this is a very long list. So that is why exercise is called polypill. That means a single pill which has multiple health benefits. There are several myths which are associated with fitness and exercises, and time will not permit to go into all those things, but it is important to debunk those myths. Don't believe them. One of the important myths is no pain, no gain. That is wrong. Now, it is important to understand the psychological benefits of exercise, yoga, and physical activity. We tend to focus more on the physical benefits, but psychological benefits are equally or sometimes more important. Exercise helps you focus better. It improves your balance, helps you sleep deeper and better, gives you peace of mind. It makes you happier in your life. You look forward to doing something more and better every time. And if you are having aches and pains, it eases your pain. And one of the beautiful effects, which is unappreciated or underappreciated, is that exercises leads to release of endorphins in our body. Endorphins are those chemicals which are responsible for relieving pain. The name is influenced from morphine. Morphine is one of the most potent drugs known to reduce pain. And our body produces its own kinds of morphines. And we are not reaping the benefits of that. And we tend to depend too much on the painkillers. Painkillers have their own set of side effects. These are the benefits of exercise for people who are suffering from diseases also, such as people from arthritis, people who are suffering from stroke, Parkinsonism, etc. Exercise helps people who are not suffering from any disease. It also helps people who are suffering from disease conditions also. And in fact, people with disabilities also can benefit a lot by regular exercises and can increase their level of ability. These are diagrammatic representation of various benefits of exercises, and you will be surprised to know that our brain loves exercises. It produces so many chemicals which enhance your mood. It relieves your pain. Now, some of the brain-derived factors help in repair of the nerve cells. It improves your mental clarity. Dopamine is a well-known chemical which, when released as a result of exercise, it improves your level of motivation, focus, and learning ability. Some of these are known as happy hormones, some are known as love hormones, etc. And it is very important to be active every day, not in certain bouts. And there are so many changes which happen to your body, and the change starts from day one. And as you continue to exercise regularly over the next weeks and months, more and more types of changes keep on adding. So there are certain acute changes in your body, and there are certain long-term changes. There are benefits which are so many, and I have already touched upon many of these things. I'm rushing through so that I can take some questions. There are some myths also related to exercises, that you can do spot reduction. It is a myth. There are different diagrammatic representation of increasing the types of exercises, range of motion, muscle strengthening, and incorporating them in different proportions. The science says that the mood benefits of just 20 minutes of exercise can last for 12 hours or more. So it is so beneficial. It is not that the benefit lasts only as long as you are doing the exercise. It stays much beyond that. This is a protocol to indicate return to exercise for non-athletes, especially important in COVID situation. And there are many other ways to exercise for mind and body. Yoga is an important one. For strength training, machines are there, free weights are there, exercise bands are there. And for aerobic exercises, walking is the safest and simplest and universal exercise. There is no excuse for not walking. You can, of course, add cycling and aquatics, etc. exercise is also beneficial for mental health, not only just physical health. And there are so many benefits that I have already told you, and they happen over a period of time. You cannot have all the benefits on day one, but if you keep progressing and regularly do it, you will feel more and more health benefits of the exercises. And there will be a stage when you will not like to quit exercising. You get addicted to exercises also. And these are some of the myths. No pain, no gain is an important one. And you need lots of protein and less carbohydrates, etc. These are some of the myths. And this I have already told you that this is a movement which was launched on 29th of August, and we are going to celebrate 2 years very soon. There are guidelines for children, for adults and older adults. I have already told you. There are guidelines which list what are the sedentary activities, what are the light activities, what are the moderate level activities, vigorous activities, and very vigorous. The risk of injuries increases with more and more vigorous exercises and activities. And you should condition and prepare yourself before you move forward. So finally, the recommendation is that everybody should be active. There is no excuse for not being active. How active you can be depends upon your previous level of health and fitness. At least 150 minutes moderate intensity per week, or at least 75 minutes vigorous intensity activity per week. It helps you build strength and bones and so many other benefits I've already told you. And most importantly, minimize the amount of time you spend in a sedentary way, looking at the mobile, laptops, or in front of the TV screens. Every 30 minutes, you get up at least for a minute or two. This will break the monotony of your sedentary lifestyle. Try to do something physical activity on most days, if not all, and try to break up the long sessions of sedentary. And these are some of the ways in which you can be more active at place of work also. There is no excuse for not being active at the place of work. You take regular breaks from sitting to standing every 30 minutes. You take stairs instead of the lift. You stand up or pace while walking or talking to somebody on phone. You limit the screen time to stay active. You walk over to speak to someone, either your boss or colleague, instead of using the phone or emailing them. Keep yourself adequately hydrated. And this is again a diagrammatic representation of how health benefits are derived in cancer-related situation. Regular exercise reduces cancer treatment-related adverse effects also. It enhances the curative effects of cancer treatment and chemotherapy. So many benefits, and these are some of the unappreciated or highly underappreciated benefits of exercises. And this is the diagrammatic representation of circuit training. Yoga, I have already emphasized enough. It is a very important thing. Now, this is one of my last slides. कोई ऐसा रोग नहीं जिसके इलाज में exercise का सहयोग नहीं. So make it a मूल mantra. In English, I would like to say that there is no disease or malady in which exercise is not a part of the remedy. If there are any questions, I will try to take it. And I thank you all very much for your patient viewing and listening. And I thank Sheela Madam for giving me this opportunity. I may have overstepped compared to the time allotted to me.
Thank you so much, Dr. Sanjay. That was such a lucid explanation of, like you said, one of the most important interventions that are so cheap, so easily available, and yet, unfortunately, most of us don't use it. I'm so happy you also brought out the points about COVID and getting back to exercise post-COVID, because I think there are people who are struggling with that. In fact, I've talked to people who are struggling even after 6 months. They've not gotten back their energy as yet.
Yeah, that is long COVID or delayed manifestations or post-COVID syndrome. There are so many names assigned to it.
Yes. I'm just going to ask the questions. There's a question from Rashi. She says, I exercise regularly, but I've been unable to increase the intensity of my workout, even after months of working out. I feel quite spent after my workout session. Is it okay to continue exercising at the same level? How can I work on that?
Sometimes it is better to step down from the intensity of exercise that you are engaged in. Because if you feel you have reached a plateau, you are not getting additional benefits and you are getting fed up, it is better to step down and maybe add a variety to the exercise program that you are having. If you have stopped enjoying the exercises that you are doing, you are not likely to benefit from that. So exercise is not just an isolated activity confined to our muscles only or bones and joints. Our whole body is involved in that. You have to enjoy what you are doing in order to get the benefits of that. And as I told in my presentation, that when you are exercising, your brain is very active at that time. It is producing so many chemicals. Your muscles are producing so many chemicals. Your fat cells are producing chemicals. So you have to let us know what is the exercise regime that you are following, which exercise for how much duration, in what sequence, etc. And sometimes it is important to pay attention that people sometimes have a thyroid related disorder, which is subclinical. And as a result of that also, their metabolism is set at a particular level and they don't derive so much benefit after months of exercise. They reach a plateau and they are not able to go beyond that. So assessment from the medical point of view, whether she's having anemia or any endocrine disturbance such as thyroid, and also a review of the exercise schedule that she's following. This may help.
Yeah. So Rashi, you may need to step down. You may need to do a physical to rule out other medical conditions, add variety. These are all Dr. Sanjay's recommendations.
And sleep and rest are also very important. Don't ignore that.
Another question, how can I include more physical activity in my day apart from my regular exercise? I work at a desk job and usually sit for really long. Buy a standing desk, Rashi.
In one of the slides, I had shown how you can increase the level of activity at the place of work, so that even if you are engaged in a desk job, and many IT professionals are, so they need to have a break after every hour or so. And then, as I told you, use the steps instead of the elevators, walk down to the washroom, have a glass of water, have some short breaks, and then come back and sit down and resume the work. It is also noted that people who keep sitting in the chair for long duration, they are more prone to develop slip disc and shoulder pains and carpal tunnel syndrome, etc. So monotony of the same static posture has to be broken if you want to avoid the aches and pains and repetitive strain syndrome and so many other things. This also strains your eyes if you are sitting in front of the screen and constantly staring for hours together. So make it a resolution that you will get up from the seat after every 90 minutes, if not after every 60 minutes.
And this, Dr. Wadhwa, to add, the standing desk has been a life changer for me.
Yes, that is true.
You know, we are on these the Zoom calls and all these meetings and, you know, sitting all the time. So, and they have some wonderful ones where you can actually, which you can actually use.
It is a good investment.
Yes.
And in addition to that, you can keep lightweight dumbbells also in your office or stretchable bands.
Yes.
You can do stationary walking. You get up from the chair, you keep walking several steps at the same place.
Yes.
This rejuvenates your body. It lubricates your joints.
Yes. So Shanti says, excellent insights into the benefits of exercise. Thank you. So Mariam asks, how does a 64-year-old recently diagnosed with cancer who has never exercised start exercising?
As I told, it is never too late. First, get the clearance from the oncologist under whose care you are there. So they will assess your current level of health status and they will guide you what will be the safe way to start. If somebody has been inactive or as a result of a disease condition has not been exercising, so the dictum is start low and go slow and keep monitoring the progress that you make. You don't have to compete with anybody else. Your parameter for comparison is what was your level of activity during the previous week. You maintain a diary, keep a record of what you are able to do. Some of the simplest things that can help you in monitoring your activity level and progress includes a wristwatch or your mobile phone. It has so many free apps to monitor your activity level, how many steps you are taking. So these things are very useful. Make use of these wisely. And then you have a weighing scale in the house, which helps you monitor your body weight. Have a measuring tape, which helps you monitor your waist circumference.
Yeah. So this is Anita. She says, exercise, physical activity, and fitness. What is the difference between these three, and what is the ideal time for each category, sir?
Physical activity is any mobility movement which involves muscle activity. Exercise is a type of physical activity which is structured. It is goal oriented for health benefits. And fitness has so many other parameters also, which is cardiorespiratory fitness, strength training, endurance, etc. So in some of my initial slides, I try to define and differentiate between these three terms. They are unfortunately sometimes used interchangeably. They are different. And with regard to the answer to the previous viewer, I can also add that it is not necessary to follow the WHO recommendations on day one. They recommend 30 minutes of moderate intensity activity daily, or at least 5 days in a week. If you have not been active, you start with 10 minutes and then add another session of 10 minutes as you feel comfortable. So there will be 2 sessions in a day of 10 minutes each. That will lead to 20 minutes in a day. And once you start feeling better with that level of activity, then have 10 more minutes added. So there are so many ways. So be creative, imaginative, but keep safety issues also in mind. Don't fall down, don't injure yourself.
Yes. There's another question. Is morning or evening better to do my walking?
It doesn't matter much. Whenever you can ensure regularity of walking, that is better. But many people prefer to start their day with a positive activity, which is an exercise or walking. At the end of the day, they may not be energetic enough to engage in the regular activity, and they may have many other excuses also. But anytime when you can maintain the regularity, that is good enough.
So it's more important that the person maintains the regularity than just any
not time. And many a times during winters, we discourage people from morning walks because the level of pollution is so high in the morning, in the winter season. So that is also an important. If you are living close to the main roads where the pollution of the vehicles is so high, so you have to pay attention to so many things when you are thinking of walking.
So those are all the questions. We're already out of time. I've kept Dr. Sanjay here for more than an hour.
It has been a pleasure.
I really appreciate your time and giving us such a, I mean, it's been a really extensive presentation. I do hope the people listening have been inspired to continue to exercise or at least start exercising, and those who've fallen off the wagon, especially over COVID, etc., please get back to it, because as you can see, Dr. Wadhwa has only mentioned 93. He says there are many more. So we really need to use exercise as the poly pill that can cover literally every problem that is available, provided it's of course done with the recommended safety measures and under proper guidance and with clearance especially if you're over 40 or if you have any other disease. So thank you so much, Dr. Wadhwa. Any last words? Anything?
No, if I am able to motivate 15 or 20 people to start exercising, I think I have done the job.
Yes, absolutely. I'm sure you have more than 15 or 20, and I will keep you posted when they post in the page, either on the page or with me. Thank you so much.
Thank you so much.
Thank you, sir. Thank you.